Today we are going to learn about the palatine tonsil. Before that, we'll learn the different types of lymphoid tissue, which are classified into primary, secondary and tertiary. The primary lymphoid tissues are thymus and bone marrow, where the lymphocytes are produced, and secondary are lymph nodes and the lymphoid follicles, which are located in the tonsils, Peyer's patches, spleen, adenoid, skin, etc., and also in the alimentary tract, respiratory tract and all that. And the tertiary are the lymphocytes. Coming to a revision of the pharynx, you know that we have the nasopharynx here, the oropharynx here, the laryngopharynx here. In the nasopharynx we have the elevation, tubal elevation. From there we have the salpingo-palatine fold, the salpingo-pharyngeal fold, and there are two folds going here, that is the palatoglossal fold and palatopharyngeal fold, and in between there is tonsillar fossa, and that is the area where our structure palatine tonsil is located. That is the one. This is the soft palate. This is the palatoglossal fold, otherwise called anterior pillar, and this is the posterior pillar, otherwise called palatopharyngeal fold, tonsillar fossa with the palatine tonsil, and this is tongue. Again, one more diagram you can see here, better picture. This is the uvula, soft palate, the tonsil, and this is the oropharynx, tongue is here. Palatine tonsil is an ovoid mass of lymphoid tissue. Location I have already told you, in the tonsillar fossa between the anterior and posterior pillars, otherwise called palatoglossal fold and palatopharyngeal fold. It has got two surfaces. This is the medial surface, and the lateral surface is here, which cannot be seen from outside. Lateral surface, and this is medial surface. It has got an upper pole and a lower pole. Medial surface, if you see, it is lined by stratified squamous epithelium, non-keratinizing, and you can see the dips of the epithelium into the depth of the tonsil, and these are called tonsillar crypts, which are about 12 to 15 in number. And there can be secondary crypts also. From this is the primary crypts, and this is the secondary crypts. Primary. One of the crypts is larger in the upper part, and it is called crypta magna. It is supposed to represent the ventral portion of the second pharyngeal pouch, and the function of the crypts is to increase the surface area of the tonsil, which are exposed to the food, and the crypts are filled with cheesy material inside, which is a mixture of the saliva and the food debris, and bacteria may be there. That is the one which is going to cause infections in the tonsils, called tonsillitis, and sometimes stones can be formed inside these crypts, and they are called a tonsillar lith or calculi. Coming to the lateral surface, this is the view of the tonsil, which is from the inner aspect, that is the cut section of the skull, and you are watching the tonsil from the medial aspect, and this is the superior constrictor, and here you can see the palatopharyngeal muscles, palatopharyngeus, the salpingopharyngeus and all that, and this is the area where tonsil is located. And lateral surface is covered by fibrous capsule of the tonsil, and the relations are otherwise called tonsillar bed, which is separated by loose areolar tissue. And because of the tonsillar bed, the loose connective tissue, we can easily do a tonsillectomy without much of dissection. And this peritonsillar connective tissue or loose areolar tissue is the site of infection usually, and that infection is called peritonsillar abscess, otherwise called quinsy. The bed of the tonsil, you can see from here, the bed of the tonsil, this is the tonsil, this entire structure will form the bed of the tonsil. The structures which are forming tonsil are the superior constrictor muscle. This is the superior constrictor muscle, and styloglossus muscle. Styloglossus muscle. This one. This is a styloglossus muscle, and the structures in the bed are the glossopharyngeal nerve, the facial artery which is here, glossopharyngeal nerve. Here is the glossopharyngeal nerve. Here, this is the facial artery, and the posterior belly of digastric, which is not shown here. Then the medial pterygoid. See, this is a mandible. Inner aspect is the medial pterygoid. Lateral aspect is the masseter, and this mandible, medial angle of the mandible. And here, this area, there is styloid process behind. So again, to repeat, the bed of the tonsil is formed by superior constrictor with the two layers of fascia, which is the inner aspect and the outer aspect, the pharyngobasilar fascia and the buccopharyngeal fascia. Then the styloglossus muscle, then the glossopharyngeal nerve, the facial artery, submandibular gland is there, the posterior belly of digastric is there, the medial pterygoid muscle, the angle of the mandible, and the styloid process if it is elongate. This is one more better diagram of it. This can see this is the tonsil, and this is the capsule of the tonsil. See this green colored one, the capsule of the tonsil, and there is a tonsillar plexus of veins here. Then after that, the superior constrictor. This is the pharyngobasilar fascia here. This is the buccopharyngeal fascia on the outside. The glossopharyngeal nerve, facial artery, styloglossus, submandibular gland. The mandible inside, mandible with the medial pterygoid inside and masseter outside. This is one more diagram to show. Here you can see the tonsil with the crypts. This is the veins, the paratonsillar vein, which is going to the pharyngeal plexus, and you can see the facial artery. This is the ascending palatine artery. Then you can see the two fascia. This is the carotid sheath and condensed mandible, medial pterygoid. And the glossopharyngeal nerve is shown here. And you can see here the styloglossus, the stylopharyngeus, posterior belly of digastric, and stylohyoid. The poles, the upper pole extends up to the soft palate, and the lower pole is separated from the tongue by this is the area where it is separated from the tongue, and this is called tonsillolingual sulcus, and it is supposed to be a site of cancer. Arterial supply, you can see there are arteries coming from the lingual artery and facial artery mainly, and also from the ascending pharyngeal artery. This is the lingual artery, this is the facial artery, this is the ascending pharyngeal artery. See the tonsillar branch of the facial artery directly coming from the facial artery. Facial branches coming from the ascending palatine branch of facial artery, ascending pharyngeal artery branches, dorsal lingual branch of the lingual artery, and descending palatine branch coming from the greater palatine artery. So to repeat, tonsillar branch of the facial artery, direct branch, the branch from the ascending palatine branch of facial artery, the tonsillar branch of the ascending pharyngeal artery, dorsal lingual branch of the lingual artery, and descending branch from the greater palatine artery. These are the branches once more. Lingual artery branches, facial artery, ascending palatine artery, the ascending pharyngeal artery, and greater palatine artery. And venous drainage, blood from the tonsil drains into the paratonsillar vein, which in turn drains into the common facial. This is the common facial, and also into the pharyngeal venous plexus. Lymphatic drainage. The lymphatic from the tonsil pierce the superior constrictor and drain into the upper cervical nodes, especially to jugulo-digastric group of lymph nodes. So if somebody asks you what is the the lymph node of tonsil, you have to answer it is the jugulo-digastric lymph nodes, and that is the commonest lymph node which is enlarged in chronic, acute or chronic tonsillitis. This is the lymph node again. I'm telling you, this is the jugulo-digastric group of lymph node. This is the jugulo-omohyoid group, just to revise. Nerve supply, the lesser palatine branch of the spinopalatine ganglion. This is the spinopalatine ganglion, and lesser palatine branch, lesser palatine going here towards the source palate, lesser palatine, and also from the glossopharyngeal nerve. So repeat, the nerve supply is from the glossopharyngeal nerve mainly, and also from the lesser palatine branch of pterygopalatine ganglion. And tonsil is one of the tissue which is been described with the inner ring of Valder. See, this is the one. This is the palatine tonsil, tubal tonsil, pharyngeal tonsil on both sides. So all these. This is the lingual tonsil. So lingual tonsil, palatine tonsil, tubal tonsil, and the pharyngeal tonsil. All these on both sides will form the inner ring of Valder. Function: it has a protective function in that it prevents entry of pathogens through the nose and the oral route. The crypts on the surface of the tonsils serve to increase the surface area and increase the efficacy of the immune response. Applied aspects: the tonsil can be inflamed acutely or chronically. Acute means usually it presents with acute pain in the throat, and when you see, there can be multiple white spots at times on the tonsil. That is called follicular tonsillitis. Or at times the tonsil can be repeatedly enlarged, infected, and it can lead to enlargement leading to chronic tonsillitis. Sometimes it can be either atrophic tonsillitis, the tonsil reduces in size, or the tonsil can increase in size, then it is called hypertrophic tonsillitis. And tonsil is one organ. When infected, it can act as a foci of testis. That means in people who is having cardiac disease, valvular disease, tonsil should be removed, because the infection of the tonsil can cause the spread to the heart and leading to infective endocarditis. And the paratonsillar vein is in the peritonsillar connective tissue, and at times there can be injury and leading to bleeding after the tonsillectomy. And also how close the glossopharyngeal nerve is there, which can also lead to injury and loss of taste sensation in the posterior 1/3 of the tongue. And the infection in the tonsil can be referred to the middle ear, because tonsil and the middle ear is supplied by glossopharyngeal nerve. Thank you.